Hey guys, it's Dr. Schulman here. I'm here with Tami. Everybody knows Tami. We're going to try something new. We're going to do something called fact or fiction. Right?
It's fact or fiction.
No, you have to say it like fact or fiction.
Fact or fiction.
Fact or fiction about plastic surgery. We have some things. These are like questions that were contributed by our viewers. I haven't seen these. Have you seen these before?
I haven't seen them yet.
Nobody's seen them before, but someone typed them up. I don't know. We're going to read them and we're going to say whether we think it's
fact or
fiction. No, do it real.
Fact or fiction.
Fact or fiction. All right, you want to go first?
Okay. Oh, okay. Are we each going to answer them?
You read it to me and then I'll answer.
Okay, I agree with that. The sun will make fresh scars look worse.
The sun will make fresh scars. That is
fact.
Fact. So when you have a scar and it's fresh, meaning the first several months, the UV rays from the sun will make that scar look more red and make it look a little darker. So we always tell our patients to avoid sun exposure to fresh scars for the first 6 months or 9 months to avoid them getting too red and too dark. So that is absolutely a fact. So make sure you put on your sunscreen right over your scars as they're healing for at least 6 months, 9 months, really for a while.
At least SPF 50, I would say.
Yes,
Yeah.
SPF 50, and make sure you reapply it because it doesn't matter how good the SPF is. If you go in the pool, you go in the ocean, it's just gonna wash off. So you got to reapply.
Yes.
All right, should I do one for you?
Okay.
Don't get it wrong.
9 years of experience.
Oh, this is a good one. Ready?
Yes.
Botox is a poison.
That is a fact.
That's a fact.
Actually, Botox is a neurotoxin, so it is technically, I hate to use the word poison. It's a toxin that can have poisonous effects.
Yeah, I mean, Botox is botulinum toxin,
Yeah.
so it's actually botulism. But what you have to understand is that it's injected. When we use it for cosmetic purposes, for relaxing lines and wrinkles, it's such a tiny dose that it really can't do any harm to your body. It only harms that little part of the nerve where it's injected. So technically, it's a toxin, it's a poison. If you are given huge amounts of it, it'll kill you. But in tiny little amounts, it makes you beautiful.
It's too gorgeous. No, it does. It acts locally right on the muscle that you inject it into. So it's not going to affect muscles used for, say, breathing if you just inject it into your forehead. So. Yeah.
And the interesting thing about Botox too is that even though it's a toxin and it injures the nerves, it only temporarily injures them. It injures them enough so that the nerves don't work for about 3 or 4 months, and then the nerves recover and the movement comes back, which is why you have to repeat treatments with Botox every 3 or 4 months.
Okay,
My
I'm going to do one for you. Okay, so someone wants to know, do breast implants need to be changed every 10 years?
Ooh, that's a tough one. So the answer is, what do we do? It's fact or fiction?
Fact or fiction?
Fiction. It's not true. People think it's true, and let me sort of go into it because it is a little bit complicated. Breast implants don't have an expiration date. They're not like car tires. It's not like they get worn out and you have to change them after 5,000 miles or 10,000 miles. So breast implants do not need to be changed after 10 years. However, the way we get that 10-year number, because it's out there, that's why people think it's true, is because most of the studies show that if you are going to have a problem, it'll happen within about 10 years. So I always tell my patients, you don't have to change them routinely, but around 10 years, they're starting to get a little bit old, and if you want to change the size or maybe swap them for something that's a little bit newer, it's reasonable to do. But if you like them and you're happy with them and there's no problem, you can leave them really forever.
And I think the FDA has to put a number on everything that they approve. So I think they do say approximately 10 years. But they recommend you change them.
Well,
Did they say that?
Not really, but
Yeah.
That's fiction. No, the reason that 10 years, but it's based on the studies that were done. So the studies that were done followed these women with breast implants out for a certain amount of time, and they really followed them out for 10 years. So after 10 years, there's not really that much data out there to know what's going to happen to the implant. So, but I do tell my patients, remember, if you get breast implants and you get them today, in 10 years, the technology is going to be so much better. So there's a good chance that you're going to want to just change them because maybe the implants that are available in 10 years is just so much better than was available when you got the implants you have now that you may just want to change them. Nobody wants to drive around in a car that's 10 years old, right?
Right.
You want to switch it up. You can. It'll get you from point A to B.
Yeah.
All right, let's do this. You guys enjoying fact or fiction?
I hope so.
I hope so too. Ooh, you ready? Mm-hmm. Another breast implant question. Breast implants can explode on a plane.
That is pure fiction.
Fiction.
Breast implants cannot explode on a plane.
They're not going to explode on a plane. This myth has been out there forever, and I actually think that they looked at this on Mythbusters once.
Yeah. That would be really crazy if they could.
Yeah, it doesn't. Well, the theory is that because it changes in pressure,
right,
that they can make your implant just kind of explode. It doesn't happen. Inside an airplane, the cabin is pressurized, which is why your head doesn't explode. So the pressure is regulated, so there's really nothing bad that's going to happen. Breast implants are extremely durable. You can probably see videos on YouTube where people are driving over breast implants with their car and they don't pop. So it's not going to happen. That's purely fiction. So not true. They're not going to explode on a plane. Can you imagine if they exploded on a plane?
I mean,
you would be on a plane
with
and you would have silicone all over you.
Yeah.
Like it would just be all over you.
And if it did explode, it would still stay in your body.
Yeah.
Unless your breast also
No,
exploded. But some patients will say, like, if they have a recently done breast aug, that they'll see more. We tell them you could expect maybe a little more swelling when you get off the plane, just like your hands or feet might be more swollen.
People just swell in general on a plane, so
yeah,
any part of your body. So if you have breast implants and it's a fairly recent surgery, maybe they'll get more swollen.
Not really the same as exploding. Okay.
Let's keep going.
Okay. You should bring photos to your surgeon of what you want to look like.
So this is actually a fact. As a plastic surgeon, I like when patients bring me photos of what they want to look like. That gives me an idea of kind of the result that they're going for. Even though we have consultations and the patients will tell me, I want to have, my butt round, but they'll say stuff like, I want my butt big, but not too big. And I want it round, but just not round like Nicki Minaj, but rounder than Kim. And they use all these things and who knows what that means.
What they're talking about, yeah.
So when they show me a picture and they say, this is what I like and this is what I don't like, it gives me an idea about exactly what they're talking about. So it's always a good idea. But we should caution people, right? I mean, you got to be a little careful about the pictures you bring.
Right. And also it helps Dr. Schulman determine like realistic expectations. So if you are a 100-pound person and you want this huge butt, he can tell you this isn't really realistic for your body type. So that I think it just helps to set like realistic expectations of like, what you can do for a patient and what you can't do.
Definitely true. I've had patients that they bring me like 100 pictures. So you want to pick, what I always tell people
They're all different.
I always tell people, like, bring me like 2 pictures of what you want to look like and 2 pictures of what you don't want to look like.
That's a good idea.
And sometimes the picture of what you don't want to look like is more helpful to me than the picture of what you do want to look like.
Yes, agreed.
Is it whose turn? Who's picking? I'm picking?
You're picking.
All right.
I'm answering.
Have we gotten them all right so far?
I think so.
We're pretty good. We should do this for a living. This is good. Temporary fillers like Juvederm, Restylane can have a permanent improvement. So temporary fillers can have a permanent improvement.
I say this is a fact.
I agree. I think it's a fact.
Yeah. There's been a lot of talk in the plastic surgery world that Juvederm, Restylane, all these fillers can actually stimulate collagen production. And patients will report that even if they get a filler like deep into a line, they'll report that their skin just looks better, their pores look better. They just see like overall improvement. And I think that the filler doesn't always fully, I don't want to say it doesn't fully go away because I don't want to scare patients.
Well, I think it fully goes away, but remember when a temporary filler is put in, so if we backtrack when we're talking about something like Restylane or Juvederm, which is the fillers that most people know the best, it's basically a sugar gel. So when we inject it into your lips or your lines or your cheeks, it fills the area and then the body breaks it down and it goes away. But during that process, there's normal inflammation that happens and it does stimulate some collagen. So when the filler goes away, there's some volume that's left there from the collagen that was stimulated during the process of it being there. So I think it's true. I think, we've both seen patients who come in and they get their, for example, they get their lips done, on the clock, like every 6 months, and they're just getting injected. And at some point they start to notice that after 6 months, it's not really gone. And then they don't need it for a year. And then sometimes they disappear.
Yeah.
And it's not that things have changed. It's just that, there's some volume there that's probably a little bit of scar tissue and collagen formation. So, so even though the fillers are temporary, they stimulate things in your body that can be permanent.
Yeah. Even me, I was doing my lips every 4 months, and I haven't done them in like a year now. So, and they're still pretty full. Okay. Scars disappear over time. Fact or fiction? This is
definitely, you're not going to like this, but this is definitely fiction. Scars never disappear. That's why they're called scars. Scars will fade, however. So whenever you have a surgery and you have a scar, we do everything that we can do as plastic surgeons to try to make that scar heal as good as possible. So we use special sutures, we use special instruments. Afterwards, we use special scar gels. We can use lasers. All these things are designed to make the scar fade and be as invisible as possible. However, it's always going to be there. So you have to understand that, and hopefully it fades to the point where you don't really notice it, especially if it's hidden in like a normal crease or a part of the body that isn't obvious. But scars never disappear, they just fade, and hopefully they fade to the point where they're barely visible, but they are not invisible.
Yeah.
Me? I'm losing track of this.
Your turn.
Okay.
To read the question.
Oh, this is
a thick one.
It's a thick one. Liposuction will make you gain weight in other places.
So this is a fiction, but
it's a fiction, but
it doesn't make you gain weight.
Right. There's a little bit of truth to this, and this is another really common question. So I'm glad someone sent this to us. People think that if they get liposuction, it's going to make the fat go to other places. So if you get liposuction on your belly, all of a sudden the fat's going to get redistributed and your arms are going to get fat. That's not true. But if you gain weight after liposuction, the fat tends not to go back to the place you had liposuction, but it's got to go somewhere. If you gain 5 pounds or 10 pounds, it's got to go somewhere. And if you had your belly lipoed, it's going to go to somewhere else, like your arms or your thighs. So that is a fiction. But there's a little bit of truth to that, because if you gain weight, the fat's got to go somewhere.
Yeah. So we always tell patients like liposuction isn't an answer. You still have to really maintain your weight after liposuction, because you could. And even the areas that we liposuction, if you gain a lot of weight, it can even go back to the area.
Eventually.
So
eventually it'll go back to that area.
It's just not a full solution. My turn to pick. We have 2 more.
2 more. I think we're on number 9 now. We're going to do 10 of these because I thought that was a round number.
Nice, good. Fillers to the lips will permanently stretch the lips out.
Ooh. So sometimes people are afraid that if they get their lips filled, that when the filler goes away, the lips are going to be kind of like stretched out and loose. That is a fiction. It's not true. The skin does pretty well. So if the skin is stretched out, it will retract and not look stretched out when that material is gone. But it's one thing when your belly stretches out from a baby. It stretches out a lot and it can't go back completely. But if we're putting filler in your lips, we're really only putting a tiny, tiny, tiny amount. We're putting in like 1 cc, maybe 2 cc's. A teaspoon is 5 cc's. So we're putting in 1/5 of a teaspoon. So it's really a drop. It may look like a lot because it's, lips get swollen and then you're putting a little bit into a closed space, but it's really not enough to stretch the lip. So don't worry about that. That's not true.
And the lip filler, unlike a baby that comes out in one day, the lip filler is slowly dissolved over time, so the skin has time to retract versus a baby that's
right. No, that's a good point, because people think that if filler lasts 6 months, that on the last day of the 5th month, they're going to go to bed and they're going to wake up on the first day of the 6th month and everything's gone.
Yeah.
That's not true. I mean, the filler tends to start going away, I don't know, maybe 3-4 months into it, and it goes away really slowly. So that gives the skin a chance to tighten up. So that shouldn't be a problem.
Okay, last question.
Last one. Make it good. Don't get this one wrong. I think we're on a streak. We're 9 for 9. Gaining weight will make the areas of fat transfer grow.
Gaining weight. So that is a fact. That's a fact.
That's a fact. Yeah. So this question's really referring to if you had a procedure like a fat transfer procedure where I took fat from your body, like your stomach, and then I injected into your butt, and then you gain weight in the future. Will your butt grow? Yeah, it's gonna grow because that's where the fat is now. I mean, that's a good thing for people. It's also can be a bad thing.
Yeah, if you have like the butt size you want, you don't want to gain too much weight because it's going to get bigger. Also, we tend to take fat from areas that people gain weight in. Like, oh, I hate my stomach. I always gain weight in my stomach. So that's where we take the fat from. Like, I feel like that's the fat that people know. I don't know how to say it. That's the area people notice the most weight gain, which is why we take the fat from there. So that fat's actually like super amenable to growing.
Yeah, I mean, fat is really tricky. It's a whole science of fat.
Yeah.
The fat cells in your arm and the fat cells in your leg and the fat cells in your stomach are all slightly different. Yeah. Some are more bioactive, meaning that if you gain weight and lose weight, the fat cells get bigger and smaller. Mm-hmm. And usually it's the stomach, which is why when we gain a little bit of weight, it tends to go to our stomach first, and if we lose weight, our stomach gets a little flatter. But areas like your lower back or your flanks or your thighs maybe never change. So when you're heavier, they don't get bigger, and when you're skinnier, they don't get smaller. They're just bio, they're not very metabolically active. Yeah. So if we take that fat cell from your stomach and we put it in your butt, it's still programmed like it's in its stomach.
Right.
So your butt is going to fluctuate a little bit with weight. So you have to be a little careful, and that's one of the reasons why, and you know this, I never say never, but at least as of the filming of this video, I don't like to put fat in the face. Because if you put fat in someone's face, like their cheeks, and then later on in life they gain a few pounds, and all of a sudden their cheeks puff up, they get that pillow face, and it looks really odd. So I think fat in the face can be a little bit dangerous if you gain weight, but if you put it in your butt, or you put it in your breast, or you put it in another area, you don't really notice little changes like that as much.
Your face is so, such a delicate structure. Even a couple pounds can really make a big difference.
Even less. I mean, look how many people, you ever wake up and you're just a little, you're a little puffy from all your boozing the night before.
All your margaritas.
and you too much salt on the rim.
Yes.
And then you wake up the next day and you feel like you're like just really like kind of puffy. Yeah. I mean, that's just nothing.
I know.
So.
Yeah, and once the fat gets bigger, unless they lose weight, it's not going to get smaller again, and that's not a quick fix.
So that was our first episode of
Fact or Fiction.
No, say it right.
Fact or Fiction.
Fact or Fiction.
Fact or Fiction.
There you go. Hope you guys enjoyed it. We'll probably do some more of these because this was kind of fun and a little bit different from the usual videos. Remember, if you like this video, what should you do?
Click on the like button.
Yes. And
subscribe.
And subscribe. That way we can keep doing more videos like this. And share it too, right?
Yeah, share it.
Okay, share it. All right, sharing is caring. This is Dr. Schulman. This is Tami. And I'll see you guys later.
Bye.